Hepatitis is a general name for liver inflammation. When the liver inflames to a particular level, you are said to have hepatitis. But hepatitis B is one type of hepatitis, and hepatitis B falls under the group of viruses called the infectious hepatitis, which is made up of hepatitis A, hepatitis B, hepatitis C, hepatitis D, and hepatitis E. So all of that, those are infectious hepatitis, meaning that you need to get an infection before you get them. But now we have other type of hepatitis that you don't need to get an infection to have them. We have something like, we have the alcohol-induced hepatitis. This is hepatitis that is caused as a result of you consuming a lot of alcohol. If you have this type of hepatitis, the best thing is for you to drop down your alcohol consumption such that you can get safe from it. And this type of hepatitis is mostly accompanied with people with heavy alcohol drinking. Therefore means if you don't drink alcohol, we don't expect you to have this hepatitis. Or if you don't even consume it much, you don't need to worry yourself about this hepatitis. But we all know that recently there was a study about alcohol drinking, which it is said that there is no safe limit for alcohol drinking, and this should be taken seriously because according to the World Health Organization, alcohol drinking affects the heart no matter the amount that you take. It therefore means if you take a little bit, you also affects your heart. So alcohol hepatitis is one of the hepatitis that you don't need to get infected with either hepatitis A, B, C, D, or E in order for you to have it. Another type of hepatitis that is not infectious, like hepatitis B, is the autoimmune hepatitis. When you talk about auto, it's like automatic. Auto means happening on its own. Like you have the automatic cars, which therefore means you don't need an ignition. The gears itself changes on its own. So auto here means automatic, happens on its own. So autoimmune hepatitis here is hepatitis that your body in itself attack itself. You have cells of the body that attacks itself. So we have cells of the liver that attack itself and cause increase in the liver cells, and this is called autoimmune hepatitis. But this is mostly provoked by drugs. People take a lot of drugs. This will be associated with them. If at all you feel any maybe issues with maybe signs and symptoms, because a lot of people ask about signs and symptoms of hepatitis, please, it is very difficult for you to start looking for signs and symptoms. But if you face any, please make sure that you visit your healthcare provider immediately. But understand that going for your checkup is always the key. Always avoid maybe waiting for signs and symptoms because it might fail you. So, but for hepatitis in general, you might have headache, you might have abdominal issues, that is stomach problem, you might have pains, or you might have swelling, of the feet, you might have tiredness, you might feel hunger even after eating. So all of these are all signs and symptoms of hepatitis. And you might also have flu-like symptoms like your catarrh. So all of these are all signs of hepatitis. But the best thing is for you to go for your checkup. Don't wait for it, because most hepatitis, especially like the hepatitis B we might be talking about, it might be chronic, meaning it might be in you for the next 10-15 years. You might never know unless you've done the test. So please make sure you go visit your doctor.